Hello, I'm Cathal O'Donnell, and in this video I will discuss the Emergency AeroMedical Service, or EAS, that is available to the National Ambulance Service. EAS is a joint project between the HSE and the Irish Air Corps. This service is in addition to the 24-hour inter-hospital transfer service provided by the Air Corps, and the project is designed to evaluate if Ireland will benefit from a dedicated AeroMedical helicopter service. EAS is a daylight service based in Athlone, the aim of which is to provide rapid response times to emergency calls in remote locations in order to either convey the patient to the most appropriate hospital or to get an advanced paramedic on scene quickly. It has a crew of 4 on board, 1 National Ambulance Service advanced paramedic, an Air Corps EMT and 2 pilots. The Athlone location allows rapid access to anywhere in the country, bringing advanced life support to patients quickly and allowing patients to be brought to the most appropriate hospital, which may not necessarily be the nearest. The helicopter is a dedicated NAS asset for the duration of the project. The service is controlled by AeroMedical dispatchers based in the National AeroMedical Coordination Centre, or NAC, in Tullamore. The criteria for launch of the EAS are designed to ensure the facility is offered to those most in need of urgent care. The criteria are as follows. The patient must be greater than 45 minutes ground transport time from the most appropriate hospital. This may not be the nearest hospital. The criteria are CPG based and vary depending on whether an advanced paramedic or paramedic crew are on scene. The most important of the criteria is section C, which states that practitioners on scene may request EAS activation if the patient does not precisely fit any of the activation criteria, but the practitioner believes that time-critical treatment or transport is required and is unachievable by ground. Subject to the criteria above, you simply make a request to your regional control centre for the helicopter. The regional control centre will then liaise with the aeromedical dispatcher in the NAC. Once EAS has been tasked, the crew will select a suitable landing zone close to the patient and pass this information through the NAC to you. Once this has been received by the NAC, the crew make their way to the helicopter for launch. The aircraft should be airborne within 10 minutes, but is often airborne in less than 5. Once airborne, the AP will inform the NAC of the revised estimated time of arrival to the patient and receive clinical updates en route. This ETA will be passed on to you. While you are waiting for the helicopter at the landing site, and if you have the time, consider checking the area for loose debris that might become a hazard in the helicopter's downwash. Also, ensure the patient and all loose articles around the patient are secured. The helicopter will conduct a few orbits overhead the landing zone to assess suitability for landing. While the helicopter is approaching, please ensure that the landing zone is clear of all personnel. After landing, the AP will assess the situation and assist as needed. If a patient is to be transported by helicopter, the AP will conduct a handover from you. It must be remembered that the EAS is not just about lifting patients, it is also capable of rapidly delivering an advanced paramedic to assist you and the patient.
How you doing, Gavin, from the helicopter? What we're going to do is we're going to load you onto the aircraft. How are you feeling?
Awful.
Good man yourself.
In most cases, the helicopter will shut down the engines after landing. However, for more urgent cases, the patient can be loaded onto the helicopter while the rotors are running. In this case, it is important to be aware of the hazards involved. Ensure you wear the appropriate safety equipment to protect against noise and loose debris. Beware of the spinning rotors, both the main and the smaller one at the rear. Only approach under control of the crew and never walk towards the rear of the helicopter. Always pay attention to what the advanced paramedic or Air Corps crewmen are indicating when operating around the helicopter. Once the patient is on board, one of the crew will escort you away safely. En route to the nearest suitable hospital, the AP will inform the NAC of their ETA. Once en route, the helicopter can travel at speeds of 200 miles per hour in straight lines and without traffic concerns. During the transit, the patient is in a comfortable and stable environment, as are the medical crew, who can attend to the patient without having to contend with the Irish road network. The patient will be brought to the nearest suitable facility, which may not necessarily be the nearest hospital. This is the real benefit of the service. For example, a standard transit from Clifton to University Hospital Galway is 13 minutes, and from Ennistimon to the Midwestern Regional Hospital in Limerick is 11 minutes. Arriving at the hospital helicopter pad, the patient will be met by ambulance crews and transferred to the appropriate hospital department. If you have already departed the incident scene with the patient, it is not too late to remember the helicopter. The NAC will coordinate with the EAS crew to meet you en route to the hospital, and the helicopter will complete the transit and release you. If you request a helicopter and you were turned down, it could be for a number of reasons. Weather may be a factor, or the aircraft could be on another call. Either way, don't forget to call it again next time. The EAS project is a one-year assessment of the need for such a service in Ireland. The success of the service depends on the helicopter being used and demonstrating that it makes a real difference to patient outcomes. EAS exists to help you deliver those better outcomes for our patients. If you're on a call with a time-critical patient and a long transport time, think EAS.